Data from the Ministry of Health shows that less than 1% of disabled persons get access to assistive devices like wheelchairs, hearing aids, crutches, among others. According to Dr. Raphael Kerio, there is a huge gap in satisfying provision of services to persons with disabilities.
There is a huge gap in terms of satisfying the provision of services to persons with disabilities in the whole range of assistive technology. Probably there is more focus on physical, and we tend to forget the audiovisual assistive technology. So the aim is to make it all comprehensive.
Speaking at the Health Symposium on Adoption of Assistive Technologies in Naivasha, Dr. Raphael hailed last year's presidential directive to integrate assistive technologies in the universal healthcare coverage, which would allow patients access to the devices through NHIF.
Since we are aware there is a presidential directive in December last year to integrate assistive technology into the universal health coverage. So we should adopt it and have the NHIF cover all the assistive technology devices.
On her part, Martha Massey, a physiotherapist from the Ministry of Health, said the center will revolutionize healthcare by enhancing access to affordable devices for all forms of disabilities, reiterating that the high cost and limited access to the assistive devices, mostly by marginalized communities, continues to inhibit acquisition.
At the moment, I would say the limiting factor and it's the topography, you know, the geographic disparities that are limit and are barriers to access of assistive technology, because in other counties that has not been embraced. Other counties, even the road network is so poor, and so we want this as an, as a policy that every county that now that Kenya has a devolved system, that this is devolved to every county.
Timothy Paku Yo, the president of African Federation of Orthopedic Technicians, lauded Kenya for the numerous strides in improving access to assistive devices for people living with disabilities, calling for enhanced collaboration among African governments to remove access barriers.
We are working on it because actually the situation, the constant is really bad. It's bad for what? You have many barriers, access barriers, financial barriers, and the lack also of professionals. And we as member of social civil workers, we are about to address the issue. There are some countries like Kenya who things are moving, and then today we are here also to encourage this kind of initiative, and this symposium also is one way to start moving forward and to improve the act.